Hello, friends. Welcome to our fifth monthly insight. And I am Dr. Harvinder Singh, creator of Psychiatry Education Forum Academy. Now, third session here is psychopharmacology for medical conditions. And the question here is, which one of these medicine is preferred for diabetic peripheral neuropathy? Is it gabapentin? Is it pregabalin? Is it oxcarbazepine or is it duloxetine? I know this is more relevant for our primary care physicians, primary care field, internal medicine, family medicine who are directly treating this. But I felt this is very relevant for psychiatry as well. Because when your patient have comorbid diabetic peripheral neuropathy, and we are using all of these medicines, right, in our practice. So this will help you choose one over another. Now, let's go to the study that answered this question. So this study was just published. You can see 2024 in the October to December section of this journal, Perspective of Clinical Research. So this was a network meta-analysis. And I will not go into details, but this is when they did this network analysis, they found 12 randomized controlled trials, RCTs, randomized controlled trials. You see 12 were for pregabalin, 2 for gabapentin, 3 for duloxetine, and only 1 for oxcarbazepine. And that is what I have seen in my practice as well. Pregabalin, commonly used. Before even I jumped into this study, my thinking was, well, we all know, I'm sorry, sneezing again today. We all know, this is my thinking, sorry, not but my thinking was, well, I think pregabalin will stand out here. And to answer that, I will say, I will divide the results in two sections here. Number one is the efficacy, and second is the side effect, right? Because we have to compare everything in the risk versus benefit. Benefit should outweigh the risk. So let's see what which one was more beneficial. And for that, I will go directly to our efficacy, where it was directly compared with placebo. And in that, this is the table from the study. This is the odd ratio. Higher the odd ratio, the better the chances, and P is your clinical significance, statistical significance, not clinical significance. And you can see the first one here is gabapentin, 3.2 odd ratio, nobody close to that. And the second odd ratio is for oxcarbazepine, followed by duloxetine and pregabalin. That was really interesting for me personally to see how pregabalin went the last and gabapentin was on top, followed by oxcarbazepine. Now, this is direct comparison. They also looked at indirect comparison where our randomized controlled trials were between these medications. And in that, this is a table. Look at the p-value. That will show you which one of them were statistically significant. Only 2 stood out. The number one is this one, the placebo versus duloxetine, and second is duloxetine versus oxcarbazepine. So in all that, duloxetine was better than placebo and duloxetine was better than oxcarbazepine. But in the end, gabapentin is the first one here, friends. That's a lesson here, followed by oxcarbazepine. Now, let's look at the adverse. So withdrawal due to adverse drug reaction. In direct comparison, here is the odd ratio of all the 4 medication. Here, the lower the odd ratio, the better, the higher the odd ratio, worse for that adverse drug reaction. Now, I will start with a low one. The best one was gabapentin here, the lowest odd ratio, 1.3, although P is not significant. And then we have pregabalin, followed by duloxetine, followed by oxcarbazepine. And this oxcarbazepine is a risky one from the withdrawal due to adverse reaction. So be mindful of that. Although oxcarbazepine came second on the benefit, but it's not good. It's like not good here. Risk factors are high with oxcarbazepine. And when they looked at specific side effect from them, the 4 common ones are dizziness, headache, somnolence, and nausea. But look at the odd ratio, but look at the p-value, right? If p is not statistically significant. It's not much relevant ideally. But you can see here, like if I don't even go into p-value, in the dizziness part, highest is for oxcarbazepine, followed by pregabalin. The lowest was for gabapentin. And in headaches, you can see the p-value highest for oxcarbazepine. Again, very big sorry, let me go back. Odd ratio is here. So highest is here for the gabapentin headache wise. And in here, somnolence, I think it should be 0.9 here. Highest is for pregabalin, but looking at statistically significance, friend, you can see dizziness, pregabalin and duloxetine, somnolence, pregabalin again, and nausea, more duloxetine, likely the serotonergic impact there playing a role. Now let's compare them in one table. So this is the summary of this study, friends. Efficacy-wise, gabapentin followed by oxcarbazepine followed by duloxetine, lowest for pregabalin. And side effect-wise, worse for oxcarbazepine. So looks like gabapentin is the preferred option here. And what are your thoughts, friends? Like, what is your choice out of these? I would learn from everybody here, right? It's a learning process for all of us. So let's see. So this was the study.